Hi everyone, welcome to SQ TV. My name is Rashmi Bharara, and today I have with me again a very special guest on the show. His name is Dr. Himanshu Patil. He is a diabetologist and an endocrinologist. He is today on the show going to speak about COVID-19 and how COVID-19 is impacting diabetic patients more. So today on the show, we are going to speak with him about that and also about the vaccination that is happening in the country. But before, let's welcome him to SCube TV. Hi, Dr. Himanshu. Welcome to SCube TV.
Good evening, all the listeners.
Okay, so Dr. Himanshu, without wasting any time, I just would like to, ask my first question to you, which is that are people with diabetes more likely to get COVID-19?
Basically, you want to know whether diabetic patients, do they stand more chance of developing diabetes Sorry. So you want to know whether the diabetic patients, they have more chance of developing COVID-19 compared to non-diabetics? Is that what you want to?
Yes,
so,
exactly.
Rather than diabetics standing more chance of developing COVID-19, what problem they face is when they contract COVID-19, they develop really serious complications. So since COVID-19 has now, we have enough data on COVID-19. It started in November 2019 and now we are in May 2021. So we have enough data to say that diabetic patients, when they develop COVID-19, they have really serious complications. That happens because their sugars are not controlled. And there are a couple of mechanisms that are related to them causing more serious complications rather than non-diabetic individuals. So I'd just like to elaborate a couple of mechanisms which make a diabetic patient fall more serious rather than a non-diabetic individual. So what happens in a diabetic individual, when the sugars go up, virus, it becomes more fierce. So basically in scientific terms, we call it that the virulence of the virus increases with hyperglycemia. So that is the first point. Then the diabetic, when they respond to the infection, that is the part of our immunity. So it has been documented that there is reduced release of interleukins, there is reduced chemotaxis, and there is reduced phagocytosis in the diabetic individual. Okay, so these are the mechanisms by which our body tries to counteract the infection. Also, it has been demonstrated that with high sugars, there is immobilization of polymorphonuclear leukocytes. So that means our white blood cells, which fight the infections, are immobilized in diabetic individual if they have high sugar. Next mechanism is that there are some diseases which are very specific to diabetic individuals, and one of them you're already coming across is the black fungus. So rhinocerebral mucormycosis. These are exclusively seen in diabetic individuals. The next one is malignant otitis media. Okay. Third one is gangrenous cholecystitis. So these are a couple of that are related to diabetic individuals. Although they are seen in other individuals, but they are exclusively related to diabetic individuals. Then the fourth mechanism is the complications of diabetes itself. So in our last video, like we had discussed, the diabetes it's a complex metabolic disorder. And when the diabetic individual has infection, so it has the diabetes, the infection precipitates the complications of diabetes itself. Like in type 1 diabetes, they're more likely to develop diabetic ketoacidosis. In type 2 diabetics, they are more likely to develop hyperosmolar, hyperglycemic, non-ketotic state. So these are life-threatening complications of diabetes, which can be aggravated or precipitated by infection. On top of that, the diabetes, it leads to it also causes organ damage. So like diabetic nephropathy. So the damage caused is to kidneys. So if the diabetic individual has nephropathy, then it all the more will make the situation even worse. So for example, a patient who has contracted COVID-19 has already got diabetes, which is uncontrolled, and has got kidney damage, which is due to diabetes. So this entire situation is going to make the situation all the more serious. So that is
Yeah.
why diabetic individuals, when they develop COVID-19, they stand a higher chance of developing serious complications than non-diabetic individuals. So diabetic individuals, basically,
Mhm.
what I would suggest is they have to be very, very proactive in detecting this COVID-19. So even if they develop a slightest symptoms, they have to be very careful in getting themselves. That is number one. So proactive in detection. Then they have to be very serious about managing their sugars. So it has also been shown in research that a well-controlled diabetic individual is less likely to develop serious complications compared to an uncontrolled diabetic individual. So they have to be really serious about their sugars. And the third thing is that they have to be very timely about the treatment. Okay, so diabetic individual needs to be proactive in detecting. They have to be serious about managing their sugars, and they have to be timely in getting treated. So if they follow all these three steps, they can I mean, we can definitely reduce the mortality troll which surrounds the diabetes and serious illnesses.
Okay, got it, got it. So they only have to do what they only have to do is they have to follow these three steps, and they really have to take care about themselves, and they're good to
To
go.
be proactive in detecting, they have to be serious
Mm-hmm.
in managing their sugars and monitoring their sugars, and they have to be timely in taking treatment if at all they are suffering from COVID-19.
So is there a treatment that they should be going under should be I mean as similar as to someone who is a non-diabetic patient, or they should have something different?
Yeah. So basically, you need to know basically what if a diabetic patient gets detected with COVID-19, isn't it? So first thing is you don't panic.
Yeah.
So you don't panic at all. If you at all you're a diabetic and you get detected with COVID-19, so keep a track of your sugars, keep a track of your hydration, isolate yourself. Okay, continue regular steam and gargles, the safety protocols that,
Yeah.
and they should contact their doctor as soon as possible.
Okay. 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 Got it. Got it. So now, doctor, coming to my next question. So, do people with diabetes, like you already have told about that do people with diabetes have a higher chance of serious complications? But are the risks different for people with type 1 and type 2 diabetes?
Yeah. So basically, we have type 1 diabetes in which people usually are dependent. I mean, they are dependent on insulin. And we have type 2 diabetes that is treated with oral medications, and people later on might require insulin. So you need to know whether they have different chances of developing diabetes or different chances of developing complications, both of them. So
Yeah.
the incident, a diabetic individual is a diabetic individual. So
Yeah.
whether it is type 1 or type 2, the chances are same of developing diabetes. It
Mm-hmm.
depends upon how exposed you are. Then
Mm-hmm.
secondly, so the complications are not only dependent upon the type of diabetes. So the complications are depending upon the age, the duration of diabetes, and the comorbidities. So for example, if you take a type 1 diabetic, his age would make a difference in developing the complications. His
Mm-hmm.
sugar control would make a difference in developing complications, and his comorbidities. So like diabetic patients are more prone to develop heart problems. Diabetic patients are more prone to develop strokes. So all these things, diabetes itself has got its own complications like retinopathy, nephropathy. So it involves the kidneys, it involves the blood vessels.
So yeah, so you were telling about are the risks different for people with type 1 and
Type
type 2?
1 and type 2. Yeah.
Yeah.
So the risks not only depend upon whether what type of diabetes the person has, but it also accounts for the age, the duration of diabetes, and the sort of comorbidities which the person has. So for example, a young person who has either a type of the diabetes but has significant comorbidities is bound to develop serious complications compared to an elder person who has no comorbidities with either type of diabetes. So it's not just the type that would govern the severity of the illness.
Okay, now got it. Now, we actually have less time, so we actually would like to, cover up the questions as far as we can. So, the next question is, what are the symptoms and signs with diabetic patient who has COVID should be looking out for?
So symptoms and signs of COVID, as
Yeah,
such, they would be
of
fixed.
COVID.
Yeah. So fever,
Mm-hmm.
having fever, cough, sore throat, loss of taste and smell, isn't it? Running nose, and then less common like headaches, diarrhea, nausea, vomiting. So the symptoms would remain the same, more or less.
So these are the common symptoms. Yeah.
Apart from these, diabetic patients may develop fluctuations in their blood sugar levels as a result of COVID-19 infections. So they should be really watchful, because any sort of infection in diabetic individual is bound to fluctuate the blood sugar.
So now my next question is, what should one think that, what should I do if one thinks that they are developing symptoms of COVID-19 and are a diabetic patient? What is that first step that a diabetic patient should take if they get COVID-19?
So any diabetic individual, if develops a COVID-19, we are already amidst a wave, isn't it? And we are seeing a lot of COVID-19 patients. So anybody who is diabetic, the first thing I would say is you don't panic at all, okay? Because that would cause all the more problems. So you should not panic at all. You should be as cool as possible, okay? Because it is in, we are through the pandemic, so they are bound, they can have COVID-19, isn't it? So
Yeah.
they should isolate themselves, okay? They should keep a track of their blood sugars. They should keep a track of their fluid intake, hydration, maintain adequate hydration. They should contact the doctor, get investigated properly, and take COVID-19 treatment timely.
So, doctor, you are saying that, for the ones who don't know, who are a diabetic patient and they don't know, so you are actually again and again mentioning that they should keep a track of their blood sugars. So how can they do that? If you can please talk about that.
So you must be coming across the word steroids very much, which is being used now. So steroids are medications which are being used to treat COVID-19. And these drugs are known to instigate changes in the blood sugars. So any patient who has been prescribed steroids should keep a track of their blood sugar levels. It is very simple to keep a track. In fact, even you can use a monitoring device, so which we call as a glucometer. Even they are sensitive enough to let you know whether the sugars are fluctuating or not. They're not very accurate, but they can be suggestive of fluctuations in the sugars. If there's a doubt that the sugars are fluctuating and they are out of range, there are several lab tests that can be done to confirm whether the sugars are raised or not.
So now, doctor, also, what are the emergency warning signs?
So emergency warning signs are, first and foremost, is shortness of breath or breathlessness, right? Okay. Second would be any pressure or pain in the chest should not be ignored, because diabetic patients usually are very unlikely to develop that typical chest pain which a cardiac patient develops. New onset of confusion, okay, or disorientation, that should be ignored. And then face or lips, if they are turning blue, that could be a sign of lesser oxygen in your body. These are the red flag signs that one should look for and seek immediate, urgent emergency attention.
So like it is said that, trees gives oxygen to live, and, the air is clear and polluted because of the lockdown, because, not much pollution is happening these days. But still, after this is going on, all this is in the news. So why are we still facing the shortage of oxygen?
Yeah. So basically you want to know that the air is getting cleaner. The pollution is reduced, the oxygen in the atmosphere is improving. Despite that, we are facing a shortage of oxygen. Is that what you want to say?
Yeah.
So basically, so this question, it's a very nice question. So basically, I want you to understand the difference between the environmental oxygen, the medical oxygen, and the industrial oxygen. So what we are talking of shortage as such is the shortage of medical oxygen. Okay. So in environment, in the atmospheric air, you have all the mixture of gases. Oxygen accounts for 21%. Okay. Most of it is nitrogen, which accounts for 78%. Now, when we are talking of oxygen shortage, it is the medical oxygen which is falling short of, which is because of more people are requiring oxygen therapy. Okay. So medical oxygen is a form of highly purified oxygen, okay,
Mhm.
which is used for treatment of particular diseases and is prescribed by medical personnel. Okay, that is the typical definition of a medical oxygen. Okay, it is carried in cylinders, and these cylinders are not allowed to mix any other gases. So it contains pure, high quality oxygen. Then there is a third entity which is called as an industrial oxygen. So industrial oxygen is used to carry out various chemical reactions, combustion reaction, and oxidation reactions in an industrial setting. That is an
Mhm.
industrial oxygen. It is a different. You cannot use an industrial oxygen for a medical purposes and medical
Mhm.
oxygen for industrial purposes. Okay. Now,
Mhm.
why we are requiring more oxygen is
Mhm.
primarily you need to understand that COVID affects the lungs. So it's a respiratory system, and
Mhm.
function of our lungs is to provide oxygen. So diffusion
Mhm.
of oxygen into the body so that the cells can utilize. So when the lungs get infected, naturally there is a discrepancy in the demand and supply of oxygen in the body, due to which the patient might require oxygen. Now, when they require
Mhm.
oxygen, they require it in different concentrations. Has got severe oxygen deficiency, you might have heard that they have been given 100% oxygen, and the atmospheric oxygen accounts for only 21%. So you cannot
Okay.
utilize the environmental oxygen for medical purposes. It needs to be specifically generated.
Mhm. Mhm.
Due to the increasing cases of COVID-19 requiring oxygen, we
Mhm.
are falling short of the medical oxygen. Yeah, so definitely the environment has improved, the pollution has gone down. That is definitely going to support the environment and pollution related problems. So naturally, we are going to
Yeah.
breathe more healthier. We are going to have
Mhm.
lesser problems compared to that are caused by air pollution. But then the medical oxygen shortage is because of more patients are requiring oxygen therapy.
I mean, also, I don't think before this COVID, a lot of people actually knew about this.
Yeah.
I think this, medical oxygen and industrial oxygen, as you mentioned, has come to notice only in this COVID, in this pandemic. People have come to,
If
yeah.
you study the usage of oxygen, if you see in last
Mhm.
when this pandemic began, the oxygen requirement as such, the utilization of oxygen has been far more in compared to in these 2 years compared to previous years.
Because even in the last year when we were listening to when we were watching news and we were listening to so many things, we don't think we actually we heard about this the need of oxygen as we are hearing about in the, in this particular year. And also recently a celebrity also tweeted that if you want oxygen, so you should plant more trees. Yeah, so I don't think if you need
It
medical
would
oxygen, you should be cared about.
no, definitely planting trees would definitely help improving the environmental oxygen, but that would not suffice
Environmental oxygen, yeah.
oxygen shortage which is being generated at present due to the lack of medical oxygen. So over a
Mm-hmm.
period of time, I would definitely encourage everyone to plant more trees so that we breathe definitely a better air and a more purer air. But then
Mm-hmm.
what medical oxygen shortage is, it would be generated by supplying medical oxygen cylinders.
Mm-hmm.
I mean, how can it compensate the acute shortage which is being faced right now?
So, Doctor, my next question is: so there has been a lot of news about which vaccine is the better vaccine. Some is saying that a vaccine that is produced in India or that is given to um, the Indian people is not that much effective, or the foreign vaccines are much more effective. So, what would you say? So, Covaxin, Covishield, Sputnik, and Pfizer, which is a better one?
Vaccine, you have Covishield, you have Sputnik 5, and you have
Mm-hmm.
Pfizer.
Mm-hmm.
Good part of all these vaccines are, they have proven efficiency. So you take, whatever vaccine is available, you can take that. All of them are efficacious. And I think there should not be, there should not be a debate that this one is better and the other one is not. All the vaccines have passed a proper trial in which they have shown that they are efficient in fighting against and developing immunity and antibodies against COVID-19.
So there is no, one should not differentiate and go what you're given, whichever vaccine that you're given. But also, I actually would like to ask you one little question over here that, this was in the news that Joe Biden, the American president, actually said that after you get your second dose of, that vaccine, their vaccine, so you can, it's okay if you don't wear a mask and if you can walk in public without wearing a mask. But in India, it is not said. I mean, even if you get your second dose, you have to wear a mask. So why is that?
So basically, after taking vaccine, we are seeing that people who are vaccinated are definitely getting less severe disease compared to people who are non-vaccinated. But that doesn't mean that people who are vaccinated cannot contract COVID-19. Okay, so vaccination doesn't offer protection against, it's not the case that if you get vaccinated, you cannot develop COVID-19. There's always a chance that you can contract the infection, but the severity would be lesser compared to a non-vaccinated individual. So if you are not vaccinated COVID-19, there could be a chance that you develop severe disease. On the contrary, if you are vaccinated and you contract COVID-19, definitely it has been shown that the severity is lesser. So the vaccine is
got it.
reducing the severity of the illness. And definitely, as you said, that after vaccination, one needs to follow social distancing, needs to wear mask, and the sanitizers and washing hands at regular intervals. All these three things need to be followed, even if you are vaccinated.
So now the next question is, can one get vaccinated with any vaccine anytime, like first dose Covishield and second Covaxin?
No, so that is not the case. So you should be taking the same vaccine in the second dose which you have taken in the first dose. So if you have taken Covishield in the first dose, you should take Covishield in the second dose. If you've taken Covaxin in the first dose, you should take Covaxin in the second dose. And that is because even though both these vaccines fight against COVID-19, there's a difference in the mechanism by which they offer immunity. So one is an RNA virus and the other one is a weaker strain of adenovirus. Okay, so the mechanism by which they offer immunity is different. So you should follow the same vaccine which you have taken before. You cannot switch amongst the vaccines in the first and the second.
Okay. And also, does an individual need to take a vaccine despite suffering from COVID-19?
Yeah. So recently the guidelines that have been generated mention that after 8 weeks, you can safely take after you have developed, you have got better from the COVID-19 infection. So you can take your vaccination dose. So you need to get vaccinated even though you have suffered from COVID-19.
Okay. Also, doctor, there have been a lot of cases where, there's this one, if a patient has suffered COVID, have got corona, and now they want to, they have, with the treatment and everything, now they are okay, and now they want to go get vaccinated. So how long?
Yes, so 8 weeks.
Should be the duration?
8 weeks after recovery. That is what.
Okay, 8 weeks. But after recovery, okay. But also, if let's suppose you have got COVID, but you didn't get yourself tested, and you also got recovered.
So then, if you.
So there have been a lot of cases where.
So basically, how do you know that you had COVID if you don't get tested?
Okay. So like, people say, oh, I might have got COVID because I got the symptoms, but I didn't get myself tested and I got recovered.
It's still that question of might would be there. Because if you know whether you've really got COVID or not, you should be having that COVID result in your hand, isn't it?
So then the people can, so if you're having this confusion, you should not wait for 8 weeks and you should go get yourself vaccinated.
Despite having COVID-19 infection, they need to get vaccinated, isn't it?
Okay. Now got it. Now, doctor, my next question is, does one need to follow all precautions even after vaccination? Can one contract COVID-19 despite vaccination? If yes, what's the use of vaccination?
Yeah. So basically, as I told you, what is the use of vaccination is a very important question. It offers you a mortality benefit. The patient who is vaccinated will get a severe disease than the patient who is not vaccinated. So definitely it's a big step forward.
Okay. So, the common side effects of vaccination?
Yeah. So the common side effects of vaccination, it starts with pain at the vaccination site. Feverish feeling can be there. Giddiness can be there. Headaches can be there. These are a couple of common side effects.
Oh, okay. So one should not worry about it, or one should not make a big deal out of
No.
it.
So if you take the vaccine, these are the common side effects which can be there. If they are worrisome, definitely you should contact your doctor. They wean off after a couple of days.
Okay, got it. So now, doctor, my last question: does